Hello and welcome to the COVID-19 presentation for early learning and childcare professionals. Our presenters today are Candice Wong and Cynthia Tang, managers of the School Child Care Center and Day Program Outbreak Team. Also, Karen Pata, Sonia Figueredo, and Wenise Tam, senior public health inspectors with the Health Protection Division. By the end of the presentation, participants should understand the updated infection prevention and control recommendations for childcare settings during COVID-19, highlights of the requirements under the letter of instruction, IPAC outbreak control measures for COVID-19, screening tool guidance, and also the process when there is an exposure or outbreak in a childcare setting. For the webinar presentation, we request microphones to be muted, questions can be shared in the chat, and after the webinar, we will compile the questions and email you a webinar FAQ document and other resources you may find useful. The webinar and FAQs will also be posted on york.ca in the near future. Today we will be highlighting key points that are found in the Operational Guidance version 8, updated on September 16, 2021. In addition, as we see here on the right, a letter of instruction was sent out via the York Region Electronic Notification System on September 15, 2021. This letter of instruction highlights additional measures to be put in place by operators of childcare settings. An updated letter of instruction was sent on October 15, 2021 as well. Both documents may be updated over time, and operators should look for updates to ensure their operations are aligned with the newest updates. We know that operators are familiar with the pre-pandemic requirements for the operation of their childcare settings, and these criteria are still alive and well. However, given the pandemic, there now exists enhanced measures in addition to all those IPAC and cleaning and disinfection practices with which you are familiar with. When public health visits your facility, it could be for a routine inspection, complaint, or for a COVID-19 outbreak investigation. This first part of the presentation will walk you through the new norm. What we mean by this is that there are enhanced practices required every day during this pandemic. Later in the presentation, we will talk about the enhanced measures that will be required if your setting should have a COVID-19 outbreak. During this presentation, we will focus on the following areas, in addition to York Region enhancements as well as outbreak requirements. Areas include cohorting and staffing, cleaning and disinfection, hand hygiene and respiratory etiquette, use of masks and PPE, transportation, physical activities and field trips, visitors, screening, space setup and physical distancing, ventilation, equipment and toy usage, and food provision. The first area we will be covering is cohorting and staffing. When we talk about cohorting and staffing, movement of supervisors, staff, and students on placement between different child care center locations and between cohorts is permitted. However, reducing movement is encouraged to minimize the potential for transmission of pathogens. Also, please ensure a separation of 2 meters between different cohorts in a shared indoor space. Ensure that there is separation of 2 meters between different cohorts in indoor common spaces, for example, entrances and hallways. And where possible, maintain 2-meter distance between children even within the same cohort. It is important to ensure that cleaning and disinfection includes a 2-step process. The 2-step process includes step 1, Clean surfaces with soap or detergent. Rinse with clean water. Air dry or dry with a clean towel. Step 2. Disinfect with appropriate disinfectant for the required contact time. Follow manufacturer's instructions and ensure the product is not expired. In addition to regular cleaning and disinfection of shared objects, regular hand hygiene and respiratory etiquette helps to reduce the risk of infection related to shared equipment. When using a disinfectant, it is important that it is approved. An approved everyday disinfectant has a drug identification number, or a DIN, a general virucide claim, and is effective against vegetative bacteria and enveloped viruses. One exception to this is household chlorine bleach, as it does not have a DIN. You can check Health Canada's website for disinfectants with a DIN. Childcare settings also should maintain a cleaning and disinfection schedule and log for all surfaces and equipment. The log should include date, time, list of surfaces or items to be cleaned and disinfected, frequency of surface or items to be cleaned and disinfected, a hand hygiene supply check, for example, checking and verifying the supply of soap, paper towel, and hand sanitizer, and the initials of the person who completed the cleaning and disinfection. On the right, we have shared our York Region Cleaning and Disinfection poster, which may be familiar to many of you. This poster also provides information on how to clean and disinfect. Frequently touched surfaces or equipment throughout the premises will need to be cleaned and disinfected twice a day at a minimum. Examples include doorknobs, light switches, handles, desks, phones, touchscreens, or any toys or equipment that are shared and used often. Some surfaces may need to be cleaned more often depending on frequency of use and level of soil, such as in a shared space. Surfaces include washrooms, like their toilet fixtures, faucets, or eating areas, such as tables, sinks, countertops. Hand hygiene must be conducted by anyone entering the setting and at regular intervals throughout the day, in addition to what is usually recommended. Perform hand hygiene before and after preparing food, eating, using shared equipment, using the washroom, disposing of waste and handling dirty laundry, after playing outside, and donning and doffing PPE. Posters and signage should be posted around the setting. Washing hands with liquid soap and water and drying with paper towels is the preferred method, especially to remove organic material such as dirt, blood, and body fluids. For hands that are not visibly soiled, the use of alcohol-based hand rub, ABHR, or also known as hand sanitizer, that contains 60 to 90% alcohol is acceptable. It is important to note that there should be supervision of use and safe storage to avoid consumption by the children. Avoid sneezing or coughing into the air. Use a tissue when possible and practice hand hygiene immediately after. Ensure support is provided to allow children with special needs to regularly perform hand hygiene. Hand wash stations should be stocked with liquid soap, paper towel, and lined no-touch waste baskets. To assist with proper hand hygiene practices, these posters are available on our website for your childcare setting. To assist with proper hand hygiene practices, these posters are available on our website for your childcare setting. All childcare staff, home childcare providers, visitors, and students on educational placement are required to wear a medical mask, also known as surgical or procedural mask, while inside a childcare setting. This includes hallways and staff rooms. When eating, time with the mask off should be limited, and physical distancing should be maintained. Medical masks must be worn by staff while outdoors also, when physical distancing of 2 meters cannot be maintained among or between cohorts. Additionally, staff working in close contact in less than 2 meter distance with children who are unmasked must wear eye protection in addition to their medical mask in both indoor and outdoor environments. A medical mask is also known as a surgical or procedural mask. Some companies label the box to indicate that they are medical masks and may also have an ASTM International Standards name or symbol. Eye protection, for example, may include face shield or goggles and some, but not all, safety glasses. Operators can verify with Health Canada or the Ministry of Labor if their products are appropriate. When it comes to children and attendees, children in grade 1 and above are required to wear a properly fitted non-medical or cloth face covering indoors. Attendees younger than grade 1 but above the age of 2 are encouraged to wear a non-medical or cloth mask while inside a childcare setting. Masking is not required outdoors unless physical distancing cannot be maintained. Physical distancing is strongly encouraged between cohorts. To assist with proper use of masks, these posters are available on our website for your childcare setting. While on transportation, all staff, home childcare providers, placement students, and other adults are required to wear a medical mask. All attendees grades 1 and above are required to wear properly fitted, non-medical, or cloth masks on transportation. All attendees below grade 1 but above the age of 2 are encouraged to wear a non-medical or cloth mask on transportation. Children from the same household should be seated together where possible. Children should be assigned seats, and a record of the seating plan should be kept to assist with contact tracing in the case of a child, childcare worker, or driver contracting COVID-19. For bus operators, eye protection for the drivers is intended to protect drivers during close contact, for example, during boarding or exiting. When it comes to physical activities and field trips in childcare settings, high contact physical activities such as basketball should only take place outdoors. Masking is required if 2 meters distance cannot be maintained between cohorts. Low contact physical activities such as jumping jacks is permitted indoors. Masking is encouraged but not required if 2 meters distance is maintained. Field trips are permitted as per the Reopening Ontario Act. Children should be cohorted throughout the trip. Health and safety requirements should also be followed as found in the operational guidance. Please note that additional requirements, such as additional screening, may be required for the location that the setting may be visiting. Operators must restrict non-essential visitors or volunteers from entering the premises. Essential visitors are permitted, but must comply to the same health and safety protocols in the guidance as staff and attendees do. This includes completing the screening, wearing a medical mask, and maintaining physical distancing from others. If more than one childcare setting or early years program is offered per building or space, a 2-meter separation must be maintained between the cohorts and must follow all health and safety requirements. If more than one cohort is sharing an outdoor space, physical distancing is highly encouraged. Additional suggestions also include planning activities for smaller groups when using shared objects or toys. Singing is permitted indoors. However, masking is not required only if the 2-meter physical distancing can be maintained. It is important to maintain the 2-meter distance between individuals within a cohort and between cohorts so that the virus doesn't have the opportunity to land on or in our mucous membranes. This includes our eyes, nose, and mouth. Operators and home childcare providers are strongly encouraged to implement best practices to optimize ventilation. Adequate ventilation should be provided by opening windows, moving activities outdoors when possible, and if mechanical ventilation is used, including HVAC systems, ensure they are in good working condition and they're regularly maintained according to manufacturer's instructions. A good resource is the Public Health Ontario's guidance, Heating, Ventilation, and Air Conditioning, HVAC systems in buildings and COVID-19. The link to this document will be provided towards the end of the presentation. Routine maintenance of equipment and toys has not changed during COVID-19. Please refer to the toy cleaning and disinfection fact sheet. But remember, frequently touched items must be cleaned and disinfected at least twice a day, which can include some toys that are frequently used or shared. If items are shared between different cohorts, ensure to clean and disinfect before sharing as well. If sensory materials are offered, emphasis is placed on hand hygiene before and after use of materials. Individual sensory play bins and materials dedicated to each attendee is highly encouraged. If items and equipment are shared for sensory play, refer to the York Region Sensory Play fact sheet on hand hygiene, as well on the selection and cleaning and disinfection of various materials used for sensory play. Provide toys made of materials that can be easily cleaned and disinfected. Unfinished or porous toys, for example, wooden toys, are not recommended as they cannot be easily cleaned and disinfected. Cloth and soft furnishings and carpets are difficult to clean and disinfect and may be at risk of mold when wet. In areas that have high potential for contamination or body fluid spills, efforts should be made to ensure surfaces are able to be cleaned, non-porous, and seamless where possible. If cloth or soft furnishings are used in these areas, covering the items with a fluid-resistant or non-porous material would assist in the ability to be cleaned and disinfected when necessary. Cloth and soft furnishings should be part of a routine cleaning program and be assessed for damage regularly. Spills of blood, body fluids, or other liquids should be contained, cleaned, and disinfected immediately. Designate toys and equipment for each cohort when possible. If not, clean and disinfect toys and equipment prior to sharing with another cohort. Most toys must be cleaned and disinfected immediately after use and are not to be shared. Most toys should be labeled with the child's name. Food premises are still required to be in compliance with the Food Premises Regulation 493. The Food Premises Regulation also requires that every operator of a food service premises to have at least one food handler on the premises who has completed food handler training at all times. They're also required to operate in accordance with all emergency orders made under the Reopening Ontario Act. Outside food is not encouraged. Daily COVID-19 self-screening is to be completed prior to arrival. Confirm daily COVID-19 screening for children, staff, students on placement, and essential visitors. Confirmation of completion of the self-screening tool may include one of the following. 1. Showing a completed record of screening, or a log that is sent home with the child each day for the parent to complete indicating they have completed the screening before sending their child to the childcare setting that day, or emailing the completed PDF from the parents to the childcare setting and maintaining these records electronically. On-site in-person screening will be done by staff as required. Records are to be kept for 30 days. Active screening will be completed on-site if screening by the parent or guardian is not completed prior to arrival to the childcare setting. In these instances, on-site screening control measures include maintaining a 2-meter distance. The screener is separated by a physical barrier, for example, plexiglass. Provide hand sanitizer at the screening stations. And adhere to mask and eye protection requirements when the 2-meter distancing cannot be maintained.
Hi everyone. I will spend the next few minutes speaking with you about our York Region screening updates. Effective Monday, October 18, York Region Public Health will require attendees, staff, and visitors to use the provincial COVID-19 school and childcare screening tool. You can find it in two ways. Click on the link here, or if you go to york.ca/safeatschool, you will be able to find the link there. This tool will provide more options for parents and guardians to screen, including the ability to share results electronically and complete screening in multiple languages. Before we go further, we just want to highlight the below bullet points. The provincial screening tool was updated on Friday, October 1st, 2021 to reiterate the need to stay home if one is sick with any COVID-19 symptoms. This information was previously missing, suggesting children and staff with mild symptoms like runny noses and sore throats were permitted to attend childcare. This change brings the provincial COVID-19 school and childcare screening tool in line with the York Region school and childcare screening requirements. All staff and attendees must screen for signs and symptoms of COVID-19 every day before attending childcare. Even if your staff is fully vaccinated, they must continue with daily screening and go for testing if there are one or more COVID-19 symptoms. Records demonstrating screening has been completed must be kept for a minimum of 30 days. For mild symptoms, you must remember that anyone experiencing symptoms, including mild symptoms not listed on the provincial screening tool, such as runny noses or sore throats, should not attend childcare. They are encouraged to stay home until their symptoms improve for 24 hours. The ministry recently updated the definition of a person who is fully vaccinated to reflect a potential third dose. To classify someone as fully vaccinated, they have to meet one of the or and one of the and. Someone who had a full series of the COVID-19 vaccine authorized by Health Canada or any combination of such vaccines, or 1 or 2 doses of a COVID-19 vaccine not authorized by Health Canada, for example, but authorized in another country, now needs to followed by 1 dose of an mRNA vaccine authorized by Health Canada, or 3 doses of a COVID-19 vaccine not authorized by Health Canada, and they meet the timeline of receiving their final dose at least 14 days ago. First, we will take a look at the direction of what happened if there is a symptomatic individual with symptoms or worsening symptoms listed on the provincial screening tool with no exposure. There are 4 situations: tested for COVID-19 and waiting for results, What happens if the test came back negative? What if someone who has symptoms and decide not to go for testing? And lastly, someone who has gone to see a healthcare provider and received an alternative diagnosis that is not virally transmissible, for example, asthma or allergic rhinitis. We have provided the return to child care center criteria for the symptomatic individual, as well as household members' instructions under these circumstances. The big highlight here is that if there are family members who are fully vaccinated or previously positive with no symptoms, they may continue to attend childcare. But if there are siblings or other household members who do not meet the definition of the fully vaccinated, they need to stay home while the symptomatic person's result is pending and may not attend childcare unless the symptomatic individual has a negative test result, receive an alternative diagnosis, or if the symptomatic individual is not going for testing, the household contacts will need to isolate for 10 days from last exposure to the symptomatic individual. Another area we want to flag is the return to child care center criteria, where you see can return to childcare after symptoms improved for 24 hours. We're getting some questions around what it means to have symptoms improved. We want to emphasize that a child needs to be well enough to return to childcare center. A child with worsening symptoms or symptoms listed on the provincial screening tool may need to return to their baseline symptoms for 24 hours prior to returning. For example, a child who has nose running and needing tissue every so often to blow their nose should stay home until the symptoms improve for 24 hours. Next, we want to highlight our instructions for close contacts. We have categorized them into close contacts who are not fully vaccinated and contacts who are fully vaccinated. Here, we see that if there is a close contact who is not fully vaccinated and has no symptoms, they are to isolate for 10 days from last exposure to the confirmed case and get tested on day 7 and continue to isolate even with a negative test result. For their household members, here are some nuances. For their not fully vaccinated school or child care center age children within the household, so for example siblings, they are not to attend school or child care center. But they are not fully vaccinated adults, they may continue to attend school or child care center as long as they do not have symptoms and stay home, except for essential reasons. We saw this quite a lot last year. If a child is dismissed from a cohort, can the parent or guardian who happen to be a staff of a school or child care center attend work? The answer is yes. If the parent or guardian are not fully vaccinated and has no symptoms, they can attend school or child care center, but not the unvaccinated siblings or children at home. If the close contacts then develop symptoms, is now classified as a probable case. The individual is to go for testing and isolate while result is pending. The household members of this probable case, if they're fully vaccinated or previously positive and have no symptoms, they can attend childcare. Next, we have close contacts who are fully vaccinated or previously positive. This one is easier to understand, as the assumption here is that the individuals who are fully vaccinated or previously positive would have some protection against COVID-19. If this individual does not have symptoms, he or she is to get tested as soon as possible and or after day 7 and self-monitor for symptoms for 10 days. If this individual develops symptoms, go for testing as soon as possible and isolate while result is pending. If negative, he or she can discontinue self-isolation once symptoms are better. Next, we have the travel question. If the attendee or staff travel in the last 14 days outside of Canada, fully vaccinated travelers without symptoms and who meet all federal quarantine exemption, he or she can attend childcare. In another word, if the travelers are not fully vaccinated, they are to follow the federal mandatory quarantine and self-isolate for 14 days, such as have a quarantine plan away from household members who did not travel. Children under the age of 12, unvaccinated, that traveled in the company of someone who qualified for an exemption from quarantine based on vaccination status, so for example, fully vaccinated parents, the children under the age of 12 do not need to self-isolate, but they may not attend childcare for 14 days after their arrival in Canada. Please note at the moment, the current screening tool, both York Region Public Health version and provincial screening tool, they both focus on the individual attending childcare if he or she travels outside of Canada. Then there's the new question. In the last 10 days, has the attendee or staff tested positive on a rapid antigen test or a home-based self-testing kit? If yes, the first step is to do a PCR test to confirm and isolate as soon as possible. For the not fully vaccinated household contacts, they must isolate until this person receives a negative PCR test and cleared by public health. Their fully vaccinated household contacts or previously positive in the last 90 days and do not have symptoms may continue to attend childcare. In case you're wondering what to do and how to keep track of those who have symptoms returning to your childcare center, some of you may have seen this before. We do have an attestation form and is recently updated to match our return to childcare center criteria. It looks like the one you see here on the right-hand side. It is available on our york.ca/safe@school website. This is optional for you to implement. The parent can take off the appropriate reason the child was sent or kept home and why they are returning. We do ask the childcare center to have a process in place to use this form. This concludes our section on York Region screening tool and attestation form.
As a reminder, childcare licensees have a duty and are obligated to report suspected or confirmed cases of COVID-19 as soon as possible to the Medical Officer of Health under Section 28 of the Health Protection and Promotion Act. When reporting a probable or confirmed case of COVID-19 to York Region Public Health, you will be required to submit an online form via this link. It is york.ca/COVID-19 school childcare form. We highly recommend that you save this to your favorites for easy access when you are made aware of a probable or confirmed case. Once you follow all the prompts and complete the necessary information, you will click on Submit and receive a confirmation number. We will receive this form on our end and assign a case investigator to review and call you back within 1 business day. Once the form has been picked up by a case investigator, an automated email will be generated to you to confirm that it is being processed. The email will look exactly like this box here on the slide. If you do not receive a callback within 1 business day of submission, we ask that you please contact us through the number or email here. The Outbreak team operates Sunday to Friday, 8:30 a.m. to 4:30 p.m. and all statutory holidays. To note, it is very important to ensure that you continue robust screening practices to screen out any individual who is symptomatic or does not pass the screening even after you reported the case to us. To give you a sense of what the reporting form looks like, we've included a screenshot of the first page. I would like to highlight the probable and confirmed COVID-19 case definitions. The ministry has several probable definitions, but for our purposes of reporting probable cases at childcare centers to us, a probable case is a person who has symptoms compatible with COVID-19 and had a high-risk exposure to a confirmed case of COVID-19. So this would include any symptomatic individuals from a dismissed cohort. A confirmed case is a person with a positive PCR COVID-19 test. Once you are past the first page, the form will prompt you to complete other components as you can see at the top here, including reporting information, case information, cohort information, close contacts, additional details, and a sign-off and review. When would public health declare a confirmed outbreak? What does it mean to be under surveillance? A confirmed outbreak may be declared when there are 2 or more laboratory-confirmed COVID-19 cases in children, staff, providers, or other visitors with an epidemiological link, such as cases in the same room or cases that are part of the same cohort, where at least one case could have reasonably acquired their infection from the setting. This also includes transportation cohorts. A facility under surveillance, however, is when there is 1 or more probable confirmed COVID-19 cases in children, staff, providers, or other visitors with exposure at the facility without that epidemiological link between cases. After we've received the reporting form, generally York Region Public Health will identify close contacts and affected cohorts for dismissal, determine if an outbreak exists when there are 2 or more confirmed cases, declare the outbreak if there is evidence of transmission within the facility, provide an outbreak notification letter for distribution to the school community, provide direction on outbreak control measures to be implemented, and declare the outbreak over when there is evidence of no further transmission or new cases reported for 14 days from the last exposure date. So you may be wondering, who will public health identify as a close contact at a facility? The cohorts of which the case is part of during their infectious period would be considered contacts requiring dismissal. Furthermore, a close contact outside of the cohort would be someone who was in contact within 2 meters for more than 10 minutes, someone who had close physical contact with, and someone who accidentally sneezed or coughed in close proximity to the case. On the flip side, these individuals would not be considered close contacts. A person who maintained proper physical distancing of at least 2 meters continuously, someone who goes to the same school or childcare but is not part of the case's cohort, someone with brief interaction and kept physical distance, or other transient interactions such as quickly passing by in the hallways or recess. It is important to note that not all scenarios are as clear-cut or black and white as what is pictured here. In gray situations, we would look at the full clinical picture, conduct our full risk assessment, and consult our public health physician as needed to confirm which individuals will be required to self-isolate. The steps for dismissals for childcare operators are: once York Region Public Health determines which groups of children and/or staff are required to be sent home, a letter of notification to dismiss a cohort will be sent to the operator for distribution to the affected individuals and cohort. In addition, a general notification letter of COVID-19 investigation and exposure in the setting will be sent for distribution to the general childcare community. We also want to go through how we've come up with some of the dates that you may be seeing in our letters or notification. Please note this is based on current ministry guidance, so if there are any updates to ministry documents, these numbers and calculations may change. First is the isolation period for the close contacts and dismissed cohorts. If you remember from last year, we kept cohorts home for 14 days. However, the ministry has now changed this to 10 days. If you report a case to us who was last at school on September 3rd during their infectious period, the dismissed cohorts and close contacts would have to self-isolate until the end of the day September 13, and that is calculated by adding 10 days from the last exposure date. Therefore, the dismissed cohorts and contacts may return on day 11 or September 14 once the full 10 days isolation period is over. As per the ministry guidance, the recommended testing for close contacts and dismissed cohort is on or after day 7 from the last exposure date. However, it is important to note that anytime an individual develops symptoms, they should get tested as soon as possible and would not have to wait until day 7. If the contact tested on day 7 and were asymptomatic, however, on day 8 or beyond developed symptoms after the initial day 7 testing, they would be recommended to get a retest to ensure that the testing date is after the symptom onset. When would public health declare a confirmed outbreak over or complete the surveillance period? A confirmed outbreak may be declared over when at least 14 days have passed with no evidence of ongoing transmission that could have reasonably be related to exposures in the setting, and no further ill or symptomatic individuals have been reported by the facility who are associated with the initial exposed cohorts. A surveillance period may be declared over when at least 14 days have passed with no reports of additional probable or confirmed cases in the setting, and no concerns of further transmissions or additional exposures. As we just reviewed in the last slide, the dismissed cohorts and contacts can return on day 11 from the last exposure date. However, the date to declare the outbreak or surveillance period over will remain on day 15. If you are made aware of a symptomatic individual from the dismissed cohort between day 1 to 14, you must report the symptomatic individual to public health immediately, as they would meet the probable case definition. A letter of instruction was recently issued by the Office of the Chief Medical Officer of Health. In addition, the Resource Guide for Licensed Childcare outlines the expectations of an immunization disclosure policy and testing requirement. These expectations include staff who do not disclose their vaccination status or are not fully vaccinated must participate in rapid antigen testing at least 2 times a week. Anyone who tests positive on rapid antigen should isolate and seek PCR testing within 48 hours. If you are looking for more information about how to obtain test kits, it can be found in the memo from the Ministry of Education dated September 14, 2021. York Region Public Health is not overseeing childcare immunization disclosure policy or testing requirements. Therefore, if you require additional clarification, please reach out to your Ministry of Education designated contact.
We will now discuss the enhanced measures that operators must follow during a COVID-19 outbreak at the childcare setting. During a COVID-19 outbreak, when it comes to cohorting and staffing, there should be no mixing of cohorts when possible. Schedule outdoor play by cohort to facilitate physical distancing. Supervisors and staff shall limit their movement between cohorts, only doing so when absolutely necessary. A separate washroom for each cohort should be used if possible. Clean and disinfect the washroom after each unscheduled use by different cohorts. Consider scheduling the use of washrooms by each cohort. In addition, further restrictions to visitors in the premises may be directed by York Region Public Health. It is important to ensure that when in an outbreak situation, that the disinfectants used are an approved outbreak level disinfectant. An approved outbreak level disinfectant has a drug identification number, or a DIN, a gender virus claim, and is effective against non-enveloped viruses. As mentioned previously, one exception is household chlorine bleach, as it does not have a DIN. When using chlorine bleach as an outbreak level disinfectant, ensure you're using 5,000 ppm as your concentration with a 10-minute contact time. You can also check Health Canada's website for disinfectants with a DIN. Ensure that a cleaning and disinfection schedule for all surfaces and equipment is followed and a log is maintained to capture when it is done. During an outbreak, it is important to remind staff and attendees on the importance of proper hand hygiene and respiratory etiquette. During an outbreak, it is important to remind all individuals in the setting on the importance of proper hand hygiene and respiratory etiquette. When in outbreak, childcare settings should ensure that there is no in-person meetings. A risk-based approach will be used to assess any needed additional control measures. It is important to note that every outbreak will have a tailored approach in terms of their additional control measures based on several factors, such as the setting, number of cases, locations of the identified cases within the childcare setting, and also movement of staff, and so on. During an outbreak, equipment and toys that cannot be easily cleaned and disinfected should be removed. Additional cleaning and disinfection for all surfaces should be in place. Ensure that any sensory play items that were either prepared or in use prior to an outbreak being declared within an affected cohort must be discarded. This includes Play-Doh and dried food items. Also, no self-serve or sharing of foods and utensils, such as serving spoons or salt shakers, at mealtime. All foods should be pre-portioned. If you'd like to contact the school and childcare team, please call the intake line 1-877-464-9675, extension 76681. You can report cases if you require assistance with our tool, or if you have questions about the screening guidance, public health measures, and others, It is also a dedicated line for school administrators and childcare operators. To report a case, please use york.ca/COVID-19 school childcare form. To contact a public health inspector, please dial the Health Connection Inspectors line, 1-800-361-5653. You can call us if you have questions about infection prevention and control practices, including cleaning and disinfection, or if you have questions about food safety, or if you have questions regarding your inspection report. Please also find here links to resources that you may find helpful for the operation of your childcare setting. Please visit york.ca/safeatschool for more information and resources. Also, Public Health Ontario has a resource on preventing COVID-19 refresher presentations for schools and childcare settings via this link. Thank you very much for joining us on this presentation. We hope you found it useful and that it will help you in your operation of your childcare setting.